In Week 11, we examine collaboration with families and interdisciplinary teams as a central mechanism for effective social and emotional interventions in special education. This work is not peripheral, it is foundational to equitable service delivery because of student growth in self-regulation. Family engagement in social and emotional learning begins with a shift from consultation to partnership. Families are not merely recipients of information. They are co-constructors of intervention goals, culturally grounded knowledge, and progress monitoring decisions. Research consistently shows that when families understand the purpose of SEL supports, and when those supports are aligned with daily routines and expectations at home, generalization improves. Visuals here should emphasize the reciprocal flow of information between school and family, illustrating shared responsibility rather than one-directional communication. Collaboration with counselors, psychologists, and social workers expands special educators' capacity to address complex needs. Counselors contribute expertise in emotional regulation, group intervention, and crisis support. School psychologists provide assessment, data interpretation, and consultation regarding behavior, cognition, and mental health risk. Social workers connect students and families to community resources and address barriers such as housing instability, attendance concerns, and access to care. An effective interdisciplinary team functions through role clarity, coordinated goals, and consistent data review. Animation can depict overlapping professional roles converging around a student profile, reinforcing the idea that no single discipline can fully address social and emotional needs alone. Culturally responsive communication is essential to ethical and effective collaboration. Language, family structure, migration history, disability beliefs, and prior school experiences shape how families interpret intervention recommendations. Educators must use accessible language, avoid deficit framing, and demonstrate cultural humility. This includes confirming understanding, inviting family narratives, and recognizing that silence may reflect deference, mistrust, or language access barriers rather than disengagement. Subtitles, translated key terms, and side-by-side examples of deficit and asset-based phrasing can strengthen comprehension and model best practice. Family collaboration is most effective when it is ongoing, structured, and measurable. Meetings should establish shared priorities, define observable outcomes, and identify supports that are feasible within the family's context. Homeschool communication logs, family goal-setting tools, and collaborative problem-solving protocols can sustain implementation over time. Ultimately, collaboration is not an accessory to intervention. It is the mechanism through which social and emotional supports become durable, culturally meaningful, and educationally impactful.